Good afternoon. My name is Abigail Willard, and I'm going to be presenting you today the role of the nurse leader in healthcare quality. And my perspective as a Christian and as a healthcare nurse leader of a quality improvement initiative and focus for my organization that we have opportunities to improve, we have to overcome our fears, to learn from our errors, to drive improvement in the patient experience. First, we must understand the quality metric of patient experience. Why is focusing on the patient experience important? Some may say that focus on the patient experience and service improves market share, it increases volumes of patients, the patients will want to come there. But I look at it as different experience and a different perspective. Focusing on the patient experience is to help improve and drive quality. And how can we do that? Well, it's our obligation as healthcare professionals to improve the patient experience by meaningful communication that is understood and understand the perspective of the patient, of what they're going through in their current condition and illness, to reduce anxiety, fear, and suffering. And when we do that and build those meaningful relationships, it improves the patient's understanding. They're more engaged in the education and prescription of a care plan that healthcare professionals are striving to implement. Looking at the data from our organization from the Hospital Consumer Assessment of Healthcare Providers and Systems, HCAHPS data, 68% of individuals of return surveys for 2016 reported that they would, yes, definitely recommend our organization. Well, even only 4% did not recommend the hospital at all. We have an opportunity to reach 28% of this entire population and influence them and say, hey, what can we do better? How can we do better? And have a better understanding of what patients are going through. In order to do that, we have to become really patient centric. And we have to engage from the bottom to the top and top to the bottom and all get on the same page to understand, really truly understand the abilities we have to improve the patient experience. So my goal through these recommendations today and our discussions today is to provide you two different phases that can help increase that perspective from the clinicians and what the patients are experiencing each and every day. An overall goal to improve patient experience metrics and especially the perception of our community to recommend our hospital and to rate our hospital above 75% that rate us 9 or 10. The American Nursing Association Standard 12 describes ethics and our ethical obligations as a nurse to develop and maintain relationships with our patients, respect their choices and their rights, the personal rights, be sensitive to their religious rights, and the dignity that the patients have in this vulnerable setting. As a Christian, this is something that correlates strongly to my faith. Each person, through God's eyes, must accept the challenges that others go through, to have a sense of understanding and strength that we can help support them through these challenging times in vulnerable circumstances. So how do nurses influence the patient experience? I had a physician once tell me that before you can care for a patient, patients need to know how much you care for them. So we need to treat every person as an individual, not a room number or an illness or condition, and know that that given patient has many trials and tribulations uh, that they're experiencing through this illness. And we have to find a way to really connect with them as an individual. And we can do that by elevating our service expectations through listening skills, through nonverbal communication, through empathy, empathetic communication, and effective communication in a way that they understand by not using large words, medical terminology, by limiting phrases that can be confusing, all right? And also to be able to explain care coordination in an effective way that they can remember, that they can speak to and recite back so they have a complete understanding of what's going on in this situation. And when we do those things, and we understand what the communication and medications are for, and when they're supposed to receive them, and why, and side effects, and then we have the patients teach that information back, then we know that they understand their role in their care. But it is the nurse's obligation to communicate in an effective way and educate our patient and family members of the care they're receiving. So what can we do as healthcare leaders, as nursing leaders? We have to continue to strive to be innovative, to look beyond the scope of traditional healthcare practices and move into a direction that incorporates evidence-based practices and research that can improve the patient experience. And then we need to be committed to that from the organizational executive team to directors and staff that evidence-based recommendations will be effective if implemented with strategic planning and thorough thought. The first recommendation for phase one to improve the patient experience and patient experience scores and data within my organization is to implement service training for nurses. In today's healthcare world, nurses work extremely hard. This is something I see day in and day out, and they can become desensitized to patients' conditions, illnesses, and situations. And that's what we have to try to fight as healthcare leaders. We must have to continue to transform how nurses view the patients and what they're going through, and promote the patient's dignity and basic human rights. Okay, that God also influences and teaches us uh, to to deliver that health care. What we can do is we can use our organizational nursing quality councils to become experts and, and super users and examples in the healthcare setting of what service training, patient experience service training, can be effective, and how, when you really implement this service training, patient experience, empathetic communication methods, learning skills, listening skills, communication skills, that it can really engage patients in the healthcare delivery. And one effective way is to use the power of the story and use the nursing council to publicize these stories of good, the bad, and the ugly. Patients that we have caught good catches by engaging in thorough assessment and learning about the patient's history and building those relationships where the patients trust in the care that the nurses are providing. And then we need to hear about the stories where patients shut down, where they turn the patients off because of a rude nurse. Or sometimes may say a nurse ratchet was delivering that care, and the patients became very apprehensive, didn't listen to the patient's education or the nurse's education, and really had a bad outcome from one attitude of indifference. And we need to eliminate those attitudes of indifferences that the nurses have. Continue to connect our mission. Our mission as nurses to serve and to protect and to provide that patient-centered care and improve the quality of care that patients receive. There's nothing more powerful than a patient telling a successful story of how a nurse saved their life, of how the empathetic connections that they make really help support them through a very vulnerable time. These stories make a tremendous role in a patient's life, and we can't underscore the value in that. And as healthcare leaders and professionals, we must highlight those situations and we must transmit those throughout the organization. And inversely, we need to also embrace the errors that we've had and the power in those stories from the errors and know how deeply rooted they can complicate the care and learn from those situations and grow moving forward. The second step in improving the patient experience is the development of an organizational patient advisory council. Incorporating patients and decision-making abilities of process improvements, creating feedback of new initiatives, how to handle reform, how to improve service standards from their own personal experiences is invaluable. And they can make meaningful change in things such as patient education, how we market, how to design environmental or redesign departments. They can play a large role in helping monitor conflict resolution. They can become great stewards in the community. They can be able, as means of effective communication to others out in the community of the challenges that we have in healthcare and also the wonderful work that we're doing to improve quality and outcomes of our patients and how committed we are. These stewards can really set the stage in the community to know that, yeah, we might not always get it right as a healthcare organization, but we are doing our best to transform healthcare and improve the delivery of care. The Patient Advisory Council should consist of 8 to 12 patients, and these patients should come from various populations. So they should have not only the Medicare population, but millennials, Generation X and Ys, male, females, different ethnicities. So really a diverse group of individuals that have different perspectives. And hopefully commit to a 6 to 12 month service of this committee. But within this committee, you need to have healthcare leaders. And what I mean by healthcare leaders is executive leaders to commit to hear the patient's perspective directly from them, to really understand the challenges and stay grounded in what is happening in the perception of our community and our patients. But also on that patient advisory council should be physicians and nurses and other healthcare therapists or clerical specialists, all other individuals that can really give productive insight as well as hear what the patient's perspective is. If we meet quarterly and have meaningful agendas and a structured framework, success isn't inevitable. We got to set expectations from the get-go, develop policies to limit risk, and really let go of that fear of them telling us the errors and the challenges that we have. Let's listen to them, and if we can commit to improving them, then you have this great stewardship, once again, that these committee members will have in the community and the public. But we have to be very detailed and structured in how we go about and develop and implementing this committee. In order to transform healthcare and improve the patient experience, we have to look at things totally different. And we have to look through the patient's eyes. For so many years, we have been looking through the perspective of healthcare professionals, not really identifying what the patient is going through day in and day out. And I'll give you a simple example. As healthcare professionals, we're standing up when we enter a room, and we engage in discussions with that patient standing up. But how is the patient? They're lying down. That's a totally different perspective. How many times has healthcare professionals gone through a facility trying to go in around in a wheelchair and enter bathrooms or get on the elevator? How many times has healthcare professionals tried to go to a different part of the country or another part of the world and speak a language and not understand what they're saying? So we really have to understand what the different populations are experiencing, view in detail, and especially as patient advisory council, view in detail from their eyes and transforming what they're going through day in and day out. These two phases may present some organizational risk. Phase one of sharing patient stories through service training initiatives and nursing councils may really highlight some nurses' lack of detail and empathy towards nursing care. And that may escalate nursing turnover. We have to be able to embrace these discussions. We must be able to adhere our failures or listen to them and learn and grow and improve them and eliminate those in the future. Also, there's going to be training expense occurred. With the tight margins today in healthcare, there's going to be a cost of training each and every individual nurse. There's going to be cost in training the super users, time for training, develop an education English training package. And this also could dilute other diversions from other healthcare quality initiatives, such as CAUTI or CLABSI reductions, or communication education, medication communication. So there could be, a diversion, but if we understand why we're doing it in a high-level view, understand that we're here to do the right thing for all of God's creatures, then yeah, I think it will limit the risks from these recommendations. Organizational risk from the Patient Advisory Council, really we have to limit strategic agendas. We can't be able to openly discuss incompetencies and incompetent practice at these committees. We really have to be centered around the focus of initiatives and support and help that we need from our community members and committee members. We can be transparent about some of our challenges in healthcare, but we really can't be totally transparent of any incompetent treatment or care provided. And this may give mixed perceptions in the community of like, really, what are they behind? So we really have to be embracing and engaging in discussions and listening to committee members and what they're having to tell us through these different agenda items. Conflict may ensue between committee members, and that means from patients to physicians to clinicians to healthcare leaders. Why haven't you done this, or why haven't you done that? I should be getting this, and that's really not the form. So having a seasoned facilitator to mitigate these discussions and to have conflict resolution is imperative and to handle these challenging situations. So a strong facilitator is very important. And then as an organization, you need to follow through with recommendations. If you accept these recommendations from the patient's advisory committee, then you really need to be able to step up and put them into action. Because the last thing you want to do is to set that perception in the community that, yeah, they listened, but they really didn't do anything with it. They didn't care what we had to say. So you really got to follow through in your actions. And we can monitor improvement of these two initiatives by patient experience data, survey data, and returns to look and see, well, is their percentage of rate to hospital 9 or 10's gone up? Recommend the hospital percentage? Yes, definitely I'll recommend it. Are those scores going up? Or nurse and physician communication domain improvements? So we can create a dashboard to see our progress on a monthly basis after training initiatives, after implementing the Patient Advisory Council, to see their effectiveness. But we have to sustain this. We have to commit to really dive in, understand what the patients and family members are going through, and make intentional improvement. Unfortunately, errors happen in healthcare. We are humans treating humans, and they're unintentional, and they're not deliberate. But high reliability organizations, we learn from our errors. And we just see if they're individual behavioral based, or is this a system process or the work conditions that are affecting the errors from occurring. So we really need to be able to understand that errors are unfortunate, but can we improve from these? Can we create opportunities to turn these errors into eliminating? Uh, no nurse ever wants to harm someone. That is absolute, and I truly believe that within my heart. But we also have to turn these opportunities into success stories. And I actually have heard it from patients that they open up about system errors or individual errors and say, I really don't want this to happen to anyone else in the future. Well, if patients feel that way, then we as healthcare professionals should feel the same way as well. Thank you for taking the time to listen to my presentation today. I can't say enough how really being intentional and focusing on the patient experience, through education and training for our nurses, through sharing the power, the stories of our influence on others, through patient advisory councils, are strategic ways that we haven't thought of and implemented before in our organization that have evidence-based results to improve the care coordination in our community deserves and expects. So thank you all for your time today, and I wish you a very, very blessed afternoon.